So CBT, you mentioned that briefly. Can you break it
Uh,
down? What does that entail? Because I mean, I'm in psychology, so I kind of know what that
yeah,
entails. But for most people out there, they don't know what CBT is.
yeah, it's a great question, Boaz. So CBT is cognitive behavioral therapy, and the premise behind CBT is that your emotional experiences have three parts. You have your cognition or thoughts, what you say to yourself, your feelings, which is really physical sensations. So what I experience physiologically in my body, and then my behavior or how I respond, what I do as it relates to emotional experiences. And what we find with CBT is that teaching clients the interconnection between their thoughts, physiological experiences, and their behavior is the key to regulating emotions. And it doesn't really matter what the emotion is. I mean, that's the T, right? Is that it's not just anxiety. It's if I struggle with anger, disgust, sadness,
Mm,
slept on emotions, as I like to say, like things we don't typically think about. Disgust is one of those things people don't really think about, right? But that's
yeah.
something you see with contamination concerns, phobias, and things like that, blood injection injury phobia, stuff like that. And ultimately, teaching a client that if you can regulate that, then you're able to reprogram, right, associations that you learn in your brain as you confront situations that trigger distress and then literally become your own antidepressant. So CBT like really makes you a superhero, really.
Yes, sir. Yes, sir. And on your Twitter, there's a hashtag as they
Yep.
do hashtag CBT Works, and
Yep.
I'm kind of curious how that came about because obviously, like I said, I do know a little more about CBT and kind of
Right.
why it came to about there was a sort of focus on medication rather than actually trying to engage a person in a cognitive behavior or something they can actually a tool they can use rather
Right.
than medicating them. So could you sort of get into how the CBT Works
Yeah.
hashtag came about?
Yeah, of course. So like on Twitter, one of the contingencies I have on Twitter, like a lot of people who know me personally, Boaz, they say that I say facts a lot. And that's true. Like I don't cap and I also say facts quite a bit.
All
And
right.
CBT works is facts, right? So ultimately, CBT works is the hashtag we use. Why? Because it works, right? So
Yeah.
anytime we talk about treating various syndromes and symptoms, right, we tend to shy away from labels. I do at least. But like when we're treating anxiety and related symptoms, we always talk about hashtag CBT works because it is the gold standard treatment. As medication typically is the first line treatment for most types of symptoms and symptomology, right?
Mm.
But the best available treatment for anxiety related symptoms is CBT. And it shows trial upon trial that it's more effective, right, than other types of therapy, as well as medication for certain problems. So again, hashtag CBT works because it does. So we always try to put that out there to educate the public on like, hey, help's available.
Mm.
It's time limited and it's something that, it's something that you can easily understand if you apply it and you're motivated to do it. So
All facts. All
yeah,
facts.
facts.
No
Straight up.
cap.
Okay.
All right. So if somebody comes to you with somebody's been struggling with generalized anxiety disorder, how would you use CBT to help them?
Yeah, that's a great question. And I think that when we think about say GAD or generalized anxiety, it's funny because like if I, take that and then add some things to it, like social anxiety disorder or
Mm,
panic disorder or agoraphobia, the way we see things, Boaz, is interesting because as a researcher too, we find that all those disorders that you and I are talking about, they all come from the same place, right? Our learning histories dictate what our focus of anxiety is on, right? And people are predisposed to have big feelings, as we like to say, right? If I get salty, I'm big salty. If I'm high, neuroticism, right? Neuroticism is the problem that many people who struggle with anxiety have at a temperament level, and that interacts with what they learn. So in the case of GAD, it's this idea that my thoughts in and of themselves, right, will lead to catastrophe. So with GAD, it's I have this strong arousal in my body associated with negative outcomes, right? So
mm,
ultimately, exposure is a super potent ingredient of CBT, part of the B part, and confronting situations where I have learned these associations in my brain and learning how to regulate my emotions in that context is the key to changing chronic worry. So in the case of worry and GAD, it's me doing things like imaginal exposure, where I'm actually high key confronting the thing I'm concerned about until my brain essentially says, yeah, shrug emoji, right? It's not as
right.
big a deal as I thought, but it's not pushing it away or suppressing it. Like, think happy thoughts, right? That doesn't work. It's more so saying, no, I need you to not only think about the worst case scenario, but I also need you to say out loud how you feel about the worst case scenario, because
Mm,
worry is a form of avoidance.
mm.
So if I confront worry, then it loses its sting, right? So that's kind of how CBT would work. with GAD and worry, and at the same time, your thoughts change by virtue of the catastrophic outcome not happening. So you have
Right.
to think differently as a result.